Hi, my name is Jennifer Wittick. I'm a physical therapist. For those of you who don't know what a physical therapist is or haven't had any experience with physical therapy, what we do is we work with patients who, due to illness or injury, have lost some of their physical functioning. And we work with them through various exercises and activities to help them regain some of those abilities that they've lost. We may work on strengthening with them, balance activities. We may work with them to help them get endurance back. Sometimes these people have lost the ability to walk or even just to be mobile, and we work with them in various ways so that they can be safe in their environment. And our key role is just to help them to be as independent as possible. Now, as caregivers, you're working with patients who have been in the same situations, and they've been ill or injured. And we just want you to know that as caregivers, we respect what you do. We really look at your role as very important. And we want you to know that you're a vital link in what we're doing with the patients as well. When I'm working in a nursing home or a long-term care facility, I really like the fact that I can seek out some of the caregivers and get their input. There are times when I may be working with a patient maybe just for a half hour, 45 minutes, but you're with that patient throughout the day. You spend hours caring for that patient, and your input is very important to me, and it's very important to the goals that I'm trying to reach with that patient. So I just want you to feel comfortable in approaching us if you have questions or concerns with that patient, and we'd like to feel comfortable approaching you as well, and just keeping communication open and working as a team. And that makes our jobs easier for both of us, and it's also very beneficial for the patient. With that said, let's move on to the topic of this video, which is principles of moving. Now, by moving, all I mean is lifting, positioning, transferring patients, and the principles are just the ideas and the considerations behind that you need to think about before you're actually physically working with the patient. You could think of it somewhat as driving a car. When you're driving a car, you may know how to put the key in the ignition, start the car, work the gas pedal, the brake, the blinkers, but there's other things that need to be considered. You need to think about, do you have gas in the tank? Do you have your seatbelt on? Is your car going to get you from Wisconsin to Florida or wherever you're going? So there's other considerations to think about, and that's the same way we like to think about principles of moving with patients. This will not really be much of a demonstration video, but I will touch on things that will be important for you to keep in mind and things that will be helpful for you when you're out working with these clients. Let's start first with just the importance of activity. Why is activity important? Why is moving these patients important? One main reason is because it's very beneficial, not only physically, but mentally. It's kind of a benefit to the whole person, the whole body. If we think of just on the very obvious level, functionally, why movement is important, movement helps you get that patient from point A to point B. You can get that patient up where they need to be. So movement is important just for a very functional reason. But movement is also important for the health of the patient, and I'll just go through a few of these health reasons, and hopefully you'll see that these things are very important, and as you look at these reasons, you'll see that it makes a big difference in how this patient is going to function and how easy it's going to be for you as a caregiver to care for this patient. First of all, movement helps to maintain flexibility and coordination, and we all know that when patients lay for a long period of time or in the same position for a long time, they become contracted. That doesn't make your caregiving any easier, and it certainly isn't enjoyable for the patient. So movement just helps to maintain flexibility and coordination. It also aids in digestion, just the whole idea that you need to keep moving to keep things moving. So get those patients up often. It improves circulation. It increases muscle strength and tone. It improves respiratory function and just helps to prevent them from getting fluid in their lungs. And there are many times that patients who are bedbound or in a lying down position for a long period of time, they end up with pneumonia, or just a lot of fluid in the lungs, and so it's very important to get these patients up for that reason. Along with the idea of digestion, it improves bowel and bladder function, and finally, it really increases mental alertness. If these patients are laying in one position all day, same four walls, same position, it gets dull, 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 their mind becomes dull. And so just getting them into a different position, maybe into a different room by moving them and transferring them, they have a different scenery, and it really helps to stimulate their brain and just makes them a more alert person during the day. That is just some of the examples of the importance of activity and movement, and I think you can see how that really helps to just benefit the patient for their general well-being and for their health. Let's move on to considerations when you're moving a patient. There are things that you'll want to consider physically. Make sure that you always know that patient's diagnosis before you go into work with them. The diagnosis is very important because it will also tell you things about the patient as far as how they're functioning. Let's say, for example, if you have a patient you're working with who had a stroke, then you may be thinking, now is this patient going to have balance problems when I sit them up? Will they need me very close by if I try to stand them? Generally with a stroke, they may have a side that's weaker, and that's very important to take into consideration when you're transferring them. If it's a patient who had a hip surgery or a broken hip, that patient may have pain, and then you will need to be thinking ahead. Does that patient need a pain pill, maybe a half hour before I go into their room and try to get them up for the day and get them washed up? It also is important as far as weight-bearing status. If you have a patient who had a joint injury, they may have a specific weight-bearing status, which means how much weight they're allowed to put on that leg or that joint. So you need to be aware of that before you're transferring a patient. Also, things like endurance. If you had a patient who had a heart attack or pneumonia, you might be thinking they may be short of breath, and maybe I should plan ahead. If I'm getting this patient up to go from the room to the dining room, is that patient going to need to rest somewhere halfway to that destination? And am I prepared for that? Will we get halfway there and not have a chair or a bench? So plan ahead by considering the patient's abilities physically before you transfer them. Also, their abilities mentally is important. You need to know if this patient is alert and if they're cooperative, if they're combative. Unfortunately, I have been working with patients who are combative, and I was not aware of it ahead of time. And so we got into a little tug-of-war struggle with my hair, and that wasn't enjoyable. And if I knew that ahead of time, I probably would not have leaned so close to that patient when I was transferring them. But that's important to know what kind of a general mood that they're going to be in as far as their mental alertness and their cooperation and how oriented they are. If they're going to understand what you're doing or not. That doesn't mean you still don't explain to them what you're doing. That doesn't mean you don't ask them to help with the transfer, but just be aware that many times that may mean you're going to be doing the brunt of the work. You may not get a lot of follow-through from that patient, and they may not remember what you asked them to do. Another very important thing is to be aware of any equipment. You want to make sure that you've got the equipment that you need in there and the supplies that you need in there prior to the transfer. Make sure you've got a safety belt to use with that person. Make sure that they have got non-slip shoes to wear for the transfer, not just some floppy pair of slippers or something that's going to turn over or under their feet when they're walking. Also, their clothing is important. Be respectful of these patients' their privacy and their modesty. I was working with a gentleman once in a hospital, and as I got him up, I tried to put a second hospital gown around him as a robe, and he kind of good-naturedly said that wasn't necessary because he had bared it all to so many people in the hospital it didn't matter anymore. He was laughing about it, but unfortunately the reason he felt that way is probably because too many people did not respect his privacy and did not keep him covered. So even if you have people who tell you not to worry about it, please cover them anyway, because even if Mr. Jones doesn't care if he's not covered, Mrs. Smith out in the hall when he gets out there may may not be too thrilled to see, his back end as he walks by. So keep that in mind for everybody's modesty and comfort. Get the assistance that you need before you transfer a patient. If it's an assistive to transfer, please get somebody to come in and help you prior to setting that patient up for a transfer. You don't want to get them halfway up for a transfer and then find out that nobody's available to help you for another 5 minutes, and by the time they're in there, the patient is tired and needs to lay back down. So get assistance and plan ahead. Be aware of any personal equipment that patient may have. If they've got oxygen tubing, IVs, catheters, you need to make sure that you know that tubing's there so you're not pulling it out during a transfer or getting it stuck on some of the equipment. Also, braces are important, and you may not know right away that they've got a brace, so you really need to be aware when you walk in a patient's room. Look around, observe. Sometimes a brace will be laying on a bedside table. Sometimes it will be down by their shoes. And braces are important. They may need a knee brace to stabilize their knee during a transfer, and if you don't put that on, you may find yourself in an unsafe situation in the middle of that transfer. Safety and body mechanics is important. Body mechanics, by that I just mean the way that you're positioning and using your body to perform some movement or activity. And we will go through this again in another tape, and I'm sure you will be reminded of this often, which is good. You want to get that ingrained in you because body mechanics and safety for your back is very important. So just make sure that when you're moving patients, you're always working with your knees bent, using your legs to help do the movement and not your back, and that you're aligning yourself properly and giving yourself the space that you need to perform the transfer. Also, as far as safety, make sure that the height of your bed is appropriate. Make sure that your surfaces are as level as they can be to make the transfer easier. Make sure that you always have the wheelchair locked. Just a couple of things I'd like to show you with the wheelchair that can make the transfer easier for some people is to remove the armrest of the wheelchair if it's in the way. That can be done by simply pushing on the little lock button and pulling up on the arm of the chair to remove it. And then the patient can sometimes more easily slide across or be helped by being pivoted or moved across to the other surface. Make sure that when you put the arm of the chair back in, that you are replacing it until you know that the safety button has popped through the hole, and then check it to make sure that it's locked in place. Leg rests are very important to move out of the way. When you have leg rests sticking out like this, you can trip over those, your patient can trip over those, they can hit their legs on them and injure themselves. It's best to just get them completely out of the way. Leg rests remove in various ways. None of them are very complicated. You'll either have a little pin that you pull up to swing the leg rest away. This one happens to have a little metal bar that you just push, and it helps to swing the leg rest out of the way. When the leg rest is swung away, that's when you can lift it up off the pins and remove it. Make sure that you don't put it down where you're going to be transferring. Get it completely out of the way so it's not interfering. After the patient is back in the chair, make sure that you replace the leg rest. These need to go over the pins while it's in a swung away position, or else they just won't fit over the pins properly. So while it's swung away, replace it over the pins and then push it back and make sure that it's securely locked in place. Just another note is the safety belt, and I know we've talked about that before, but always use a safety belt in transferring a patient. Explain to them why you're putting it on, but use that for their safety as well as yours. And very importantly, take your time. We all know that we're busy while we're working, but a couple extra minutes to make sure that you do the transfer correctly and properly, and that the patient feels comfortable with that transfer is well worth that extra time that it takes. So slow down, care for your patient in a relaxed and casual way so that they don't feel anxious and nervous about what you're doing with them. The final point in considerations is very important. I can't stress this enough. This is to involve the client. When you are working with a client or a patient, when you are transferring them, you need to always explain what you're doing. And don't think that because you explained it yesterday, you don't need to today. Many of these patients are confused, they're forgetful, they may not even remember who you are when you walk in the room. So introduce yourself each time. Tell them who you are, what you're planning on doing with them. Tell them, Mrs. Jones, I'm here to help you get up for breakfast, and I'd like to help you sit up on the edge of your bed, and I'll help you to get into your chair. And as you're doing the movements, explain to her how you're going to be helping her and what she can do to help as well. Reassure her so that she's not anxious or uptight about these things. And also ask for your patients to help you as much as is appropriate, as much as they're able to do. There's so many times that these patients just have things done for them continually. They just start to believe that they are unable. They believe that they can't do it, that they are worthless, they don't have any use. And that's really a terrible position for a patient to start to, a terrible way for them to consider themselves. So, very, very importantly, ask them to help you. For one reason, kind of the use it or lose it idea. If they're not using their muscles and using these, doing these activities, they're going to lose their ability to do this. When we're working with a patient in physical therapy, we really appreciate the follow-through. If I'm in working with a patient and I'm trying to work with her on coming to a stand from a wheelchair more independently, and I'm there 2 or 3 times a week, and you're there daily and helping her get up, 3, 4, 5 times a day, if you are just pulling her up to a stand, then my work is really not going to pay off. So it's really helpful if you can have the patients help with as much as they can just from a rehab standpoint. And like I said, most importantly, psychologically, that patient needs to feel worthwhile and needs to feel like they can do some things. And I really think that you'll develop a better rapport with your patients, and they will feel more cooperative about doing things with you if you enlist their help and ask for their help. What I'd like to do, there's a few devices that you may see commonly used in different facilities that can help you with moving or transferring patients. And I would like to demonstrate a couple of these for you and at least show them to you so that you're aware of what they look like. If you see these in a facility, you'll know what it is and generally how it's used. There are some devices that you will find when you're working in facilities that are commonly used to help assist you in transferring patients from one surface to another. I'd like to just show you some of these devices so that you're aware that they exist and what they look like. This is what we call a transfer disc or a pivot disc. May not be used frequently, but in case you see it, you won't wonder what this thing is sitting in the patient's room. This is something that is used on patients who are not able to do a pivot transfer very well, or that they need a lot of assistance with a pivot. They can't move their legs to get from the bed to the chair. They may be stumbling over their feet, and it just is safer for them to actually have their feet on a disc that will just pivot as you transfer them. This disc is just placed under the patient's feet before you bring them to a stand. You make sure that it's securely under their feet, and as you use the safety belt and bring them to a partial stand, you're just pivoting them, and the disc will slide with you. It's not difficult to use, but I would suggest that you practice using it before you ever use it on a patient. This is called a slide board. Some people call it a transfer board. This one is made of wood. You can see that the ends of it are tapered. That just assists the patient in being able to get on and off it more easily. A transfer board sometimes is made of plastic. Sometimes they're longer or shorter, just depending on the patient's needs. Either way, they're used basically in the same way, and they all basically look the same. And what you would do with this, I'm not going to demonstrate it for you right now. I will do that in another video. But what you do with this is it's basically bridging the gap for the patient between surfaces, maybe between their bed and a chair, or going back from the chair to the bed. And you slide one end of it under one of the patient's buttocks, and then they're helping with the transfer, and they're just sliding across the surface while you use the gait belt and help them to slide across that surface. It can be done very safely and effectively. It's not hard for the patient to use, but I do want to point out that this is used on a patient who would not be bearing weight for whatever reason, would not be putting weight through their legs, either because they're not able to because of an injury, or they just are too weak to do that or too large to do that. These boards need to be used on patients who do have good upper body strength, upper trunk strength, because they do need to be able to control their trunk for balance while they're moving. You won't be able to do that for them. They need to be able to do that while you assist them in sliding across. Another device, which I guess we could call it a device, sometimes you can use the bed, if it's an electric bed, to your advantage in helping to move or transfer a patient. Many of the beds now in facilities are electric. Keep in mind that you can use the settings on these beds to make your transfer easier. If you need to lower the bed so that the patient, so you can have their feet reach the ground, you can go ahead and lower the bed down. If you need to raise the bed to even out surfaces between transfer heights, do that. The bed can also be used to assist you if you're trying to raise, get the patient up into a sitting position. You can raise the head of the bed, and that way the patient is in more of a sitting position to get you started so the bed can raise up. Please don't do that if we're working with this patient on the functional goal of getting from laying down to sitting up. And hopefully if we are, we've made you aware of that. But if that's not a goal of the patient's and it just makes it easier for you, please use the settings on the bed to assist with that. You can also use the foot side of the bed and raise that up just to have gravity help you if you're trying to move the patient up in bed. If they need to be repositioned or shifted up in bed, leave the head of the bed down, raise the foot of the bed up, and that way gravity is helping, and you can get them sometimes to help too by pushing, and it's just an easier transfer and an easier move. Another device that can be used to assist you in moving the patient is called a lifter sheet or a draw sheet. A draw sheet is basically just a flat sheet that's been folded in quarters or in halves, and it's placed under the patient so that with the assist of another caregiver, you can slide that patient forward in bed or readjust and position them better. Make sure that when you place the draw sheet under the patient that you've got the folded edge up towards their head or their neck and the unfolded edge down near their knees. We won't put this one under the patient because there's already one placed there. When we do this, we want to make sure that we have the bed up to a position that's comfortable for us and isn't putting strain on our backs. And we'd also want to lower the arm rails, the bed rails, so that they're not in our way. Remember, we want to explain to our patient what we're doing and just let her know that we're just both here to help reposition her in bed and to help her feel more comfortable. The draw sheet needs to be untucked and then just kind of fold it up alongside. You can explain to your patient that she can just place her arms, fold her arms on her chest or her stomach, and what we're going to do is grasp the draw sheet around the knee and the shoulder area on each side. And what we'd like to do, if the patient can bend their knees, have them bend up just to assist you. That way their feet are in a position where they can help to push as you're pulling them up in bed. Also be aware that you want to remove the pillow and place it at the top of the bed so that it's easier to slide them up, and also they won't have any chance of hitting their head on the headboard of the bed. What we will do is we'll have our feet spread apart for good body mechanics. We'll use our legs and our body to do the movement, and on the count of 3, we'll shift our weight from our back leg to our forward leg while we're sliding her in bed. Now we would explain to our patient as we do this, if you could just push with your legs and help us to slide forward. 1, 2, 3. And then we have her positioned higher up in bed. We'll reposition her pillow so that she's comfortable. Make sure that you pull the draw sheet straight and flatten out any wrinkles so that she's not laying on wrinkles. and then you'd leave this draw sheet in place for future use. Now, just so that you're aware, sometimes these patients, if they're incontinent and they tend to soil or wet the bed, they may have what's called an incontinence pad underneath them. Because it's positioned in about the same place, sometimes this is used as the draw sheet as well. So be aware of that. This is an easy way to move a patient and position them, so don't forget that when you do this type of a movement, get the assist of another caregiver so that you're not injuring yourself. Now, a mechanical device is used on patients where other types of transfers aren't appropriate or where they just wouldn't work. Sometimes the patient is completely immobile. Sometimes they're just too large and it wouldn't be safe to do a two-person transfer, and then they need a mechanical lift. A mechanical lift is something that usually involves the lift and a sling. The sling is used to position the patient on. They're usually positioned in the middle of the sling. And then there's chains that hook up to the corners of the sling. And then this sling is raised and lowered off of the surface using the mechanical lift. They're very safe, but your patients will need reassuring because nobody's comfortable when they're suspended in air. So keep in mind that when you use a lift, you always use it for short distances, and you always just raise it as high as is necessary to move the patient from surface to surface. Just so you're aware of what some of these look like, this is called a Hoyer lift. This one basically uses a hydraulic action to raise and lower the patient. Sometimes it's a pump, and then you have a valve that you release to slowly lower them to the next surface. There are various types of mechanical lifts, and when you work in a facility, you'll need to become aware of which type of lift they use the most, and make sure that you're trained in that lift and that you're comfortable using it before you attempt to use it with a patient. Most lifts also, facilities require two of you to be working with the patient when you're using a lift. Keep in mind that there are things you always need to think about when you're working with patients. There are considerations for the patient and for safety and for the patient's involvement. And hopefully when you're out working, these things will pop into your mind and you'll remember that these are important. If you start doing these as a habit, it will just become a natural way of working, and your job will be more enjoyable to you and more enjoyable for the patients you're working with.
Hi, my name is Terry Walters. I'm an educator at a long-term care and subacute facility. You've just seen the Hoyer lift, the lift that lifts the patient's body completely. Now I'm going to be showing you the standing lift, a lift that can be used to lift a patient from one seated area to another seated area. For example, this lift can be used to lift a patient from the side of the bed to the wheelchair or from the wheelchair to the toilet. Remember that this lift is not meant to be a conveyance, however, so you wouldn't use this lift to move a patient down a hallway. Our facility purchased this lift really with one patient in mind. He was 99 years old, and the thing that he wanted to do the most in life was use the toilet. The Hoyer lift was not possible to use to put him on the toilet. It was difficult for our staff to lift him, and he was really too weak to walk. This lift has helped him gain some independence because we can very easily and quickly move him from his wheelchair to the toilet, and he really loves this lift, so do we. In order to use this lift, the patient should be able to bear at least partial weight. In other words, patients should be able to stand on their legs at least a little bit. Patients should also be aware that they're being lifted. The standing lift consists of a number of components. First of all, there's the base that the patient's feet are placed onto. Next is a padded surface that the patient's knees will go up against. And that padded surface is adjustable so that you can bring it out or in depending on the length of the patient's legs. Next are the lifting arms. These are the arms that will actually be lifting the patient with a sling attached. And next are the controls. There's really two controls on this machine. One is a control that's built in That's an up button and a down button to raise and lower the arms. The other is a remote device so that you could actually move away from the machine a little bit, a little closer to the patient, and you can use these buttons to raise and lower the patient. So that's the remote. This particular lift has a battery that is an integral part of the lift. When the battery runs down, it is simply pulled out and replaced with another battery that's been waiting in the charger. And those two batteries can simply be rotated as needed. Next, I'm going to show you how the base widens. By simply pressing down on the pedal, we'll widen the base. The reason that it's a good idea to have the base at its widest angle is so that we have a broad base of support when using the lift to lift a patient. It adds to the stability of the lift. Next, I'm going to show you the sling that's attached to the lift to help lift the patient into the standing position. The sling should be checked before each use to be sure that it's intact and in good condition so that it's safe for us to use on the patient. The sling wraps around the patient in this manner. There is a safety strap that can be secured. When you secure the safety strap, you don't have to make it too tight, but you should just make it secure so that it's not going to slip too much. At the ends of the slings are some color-coded loops, and the purpose of the loops is to allow you to bring the patient close to the lift or keep the patient further away from the lift, depending on the patient's size as you're using it. The sling should be washed when it becomes visibly soiled. Mechanical lifts have weight limits. This particular lift has a weight limit of 350 pounds. Always check with the nurse to find out the weight capacity of the lift that you're going to be using. Now I'll cover some safety considerations to keep in mind when using the lift. 2 persons should be used to lift a patient with a lifting device. Check with the nurse to learn the weight capacity of a lift that you will use. The base should be open to its widest angle to give the machine a wide base of support. Lock the base while preparing to lift the patient. The sling should be checked before each use to make sure it is intact. It's important for patients to keep their arms on the outside of the sling while they are being lifted. During the lift, instruct the patient to sit back instead of leaning forward. While lifting, check the sling loops to make sure they are connected correctly to the lift. Our patient, Mrs. Johnson, and I are now going to demonstrate the standing lift for you. Mrs. Johnson, this lift is going to lift you up from the edge of the bed over to the wheelchair. It's going to be comfortable and safe, and I'm going to explain exactly what you need to do. First of all, I'm going to be moving the lift closer to you, and I'd like you to put your feet on this platform. I'd like your knees to be comfortably up against this padded area. Okay? And I'm going to lock the base. And then we're going to place this sling around you. The sling has a safety strap. When you're securing the strap, you don't want it to be too tight, just comfortable. Now I'm going to place the ends of the sling into the loop holders. What I want to do is put them through the loops that will allow me to have Mrs. Johnson as close or as far away from the sling, from the lift that she needs to be. I'm going to choose the yellow and purple loops to put this through. And I'm just going to... Okay. Now I'm going to have you put your arms on the outside of the sling and hold on to the lifting arms. I'm going to move around to the controls as our second person joins us to guide Mrs. Johnson into the wheelchair. We're going to unlock the base. And meanwhile, our second person has locked the wheelchair so that we're sure that the wheelchair isn't going to slide while we're doing the lift. Okay. Mrs. Johnson, I'd like you to lean back slightly while we do the lift. That's perfect. And that's going to keep you right in the spot where you should be in the sling. She's cleared the surface, so now I'm going to move her over to the wheelchair. Okay, the second person makes sure that Mrs. Johnson is far enough back in the wheelchair, and when everything is set, I lower the arms. Once the patient is in the wheelchair, the sling can be removed. You've just seen a demonstration of the standing lift. Thank you for watching, and good luck to you in your training.